A recent study by the Centers for Disease Control is alarming. The study shows prescription drugs have a higher overdose rate than heroin and cocaine combined. Plastic surgeon Dr. Bill Adams says the most prescribed medication in America is hydrocodone, an extremely addictive painkiller. To keep patients safer, Adams says doctors need to be more cautious and limit a patient's narcotics to no more than a 10-day supply.
And the patient can always come back to us if they're having a problem. The reality is that if somebody needs more pain medicine than that, then there may be something else going on.
We asked surgeons what can be done to help curb this epidemic. One solution is a new formulation of an old drug that keeps patients comfortable in those first few critical days after surgery. The new drug is called Exparel.
This drug is injectable. We use it at the time of surgery in the areas that we've operated, and it does wonders to control pain in the 72 hours after surgery.
I never had to ask for anything for pain, and I never got to that point where it's like, oh, when are they going to bring something else? And then it was just easy.
Now we don't have to rely on high doses of narcotics that lead to complication. 50% of patients who take pain pills have some adverse effect with them.
Over the past year, Smith says his practice has performed hundreds of surgeries using Exparel. He says of those patients, 50 were involved in a study looking at pain management after surgery.
We found that the average number of pain pills the day after surgery that patients took was 4. In general, the amount of pain pills was 60% lower than the average patient before this medication.
I've had other surgeries where you were just like, okay, counting down the time when you could take more pain medication, and it wasn't that way with this.
If patients are in less pain, doctors won't have to prescribe as much or any prescription pain medicine, hopefully making a dent in the prescription drug epidemic. Carolyn Grimes reporting.